Welcome to our burn class. I'd like you first to take a moment to take a guess on what the most common burn in the backcountry is. If you guessed a sunburn or a hot water burn, you are correct. Those are the most common burns in the backcountry. We want to talk a little bit about prevention. Burns are something easy to prevent. If you think about our patient assessment triangle, our number one thing is scene safety. And so as you go in, you want to make sure whatever burned them is not going to burn you. The second thing is as you go through life threats, we want to stop the burn. So this is cooling the burn for 15 to 20 minutes. You can do this while you're doing the rest of your assessment. The last thing we're going to do is treat the burn and wrap it. So let's talk about types of burns. The skin is divided into some layers, and so we have a superficial, partial thickness, and full thickness burn. So superficial, take a guess on what that might be. If you said sunburn, you're correct. Okay, so just a sunburn. Is it painful? Yes. What color is it? It is red. It is pink. Are there blisters? No. Just the superficial portion, there's no blisters. You don't need to evac. However, some people find having a superficial burn in the backcountry is not very comfortable and they want to leave. That'd be a non-medical evac. Partial thickness. Okay, we're partway through all the layers of the skin. Is it painful? Yes. Red, pink. This also become mottled. So kind of red and white, splotchy. And there are blisters. Okay. And typically we do evac all of these, but isolated small portions, you might have some partial thickness that stay in the backcountry. We'll talk about evac criteria in a minute. Full thickness. Ironically, there is no pain. You have severed all the nerves. It's either going to be pale or charred. Okay, this is not fun for the patient. There are no blisters, and it's an automatic evac, no matter how big or little. So this is helpful. A lot of times people don't have uniform blisters or burns. They'll have something that's got some superficial, some partial thickness, some full thickness, or just superficial and partial. When we think about evacuation, we think about three criteria. How much of the body, what percentage is damaged, what is the depth, and what is the area. And when we say depth, we mean this. So we want to use what's called the rule of palms. Okay, when you take your hand, including the palm, this is 1% of your body. Okay, so if you have a patient who is little, that 1%, you have to use their hand. So if you burned this entire arm, take a moment to see how much percentage that is of your body. It averages about 9%. So anything that's greater than 10%, we're going to rapidly evac. Anything that's circumferential, that goes all the way around, we're also going to rapidly evac. Our full thickness, they're all going out rapidly. And then anything that is an airway, hand, feet, armpit, or groin, these are special uses. We want to get those out quickly. If you think about this, burns take a lot to manage in the backcountry. This is not something easy to deal with. It takes a lot of resources. And on top of that, folks are usually pretty uncomfortable. So it is better to spend some time educating and managing your participants on how to not burn themselves and focus less on how do I treat each depth of burn. When it comes to dressings for this treatment, We're gonna do what's known as a dry dressing. We're not gonna put anything else on that dressing. And the reason being is that that can cause the patient to lose a lot of fluids if it is a cool compress or a cold compress. Sometimes it is common for folks to have small burns on their hands, stay in the back country, and that might be an acceptable time if you can manage it. So stay safe, cook at ground level, put on sunblock, and prevent burns, and I hope you never have to evac for one.